I've had arthritis in my legs and in my arms.
As far as managing pain, we also try to prepare him for what's going to happen, and oftentimes it's a lot of reassurance that, you know, the doctors are going to make sure that this procedure doesn't hurt. You're going to go to sleep, and when you wake up it'll be over, and that kind of thing.
Well, it hurts when I walk and move my leg a certain way.
Just lots of kind of talking him through things and using various deep breathing types of strategies to get through the actual pain.
Staying distracted helps my pain. Thinking about it makes it worse.
I would say that's probably the most stressful thing about the hospital, is whatever kind of pain could be anticipated for them.
It's not fun to be in the hospital, but there's a lot of board games that kind of keep you distracted from it, and they do the best they can to make you feel comfortable. When I have to get an IV or a blood draw every day, and I don't really like that stuff, or when I have to get a lot of stuff taken, like tests and all that in a day while I'm at the hospital, it's not fun.
How do you deal with that?
Just by knowing that when it's done, I'll be able to just do what I was doing after.
We checked into a lot of things about pain. When Laura was trach, she had a lot of pain because she was in bed a lot. And palliative care gave us some patches with lidocaine on them, and that helped out a lot. And you can tell when your child's having pain or when it's just they're uncomfortable. And you have to be an advocate for them too and help them be heard. So I know that we worked really hard on this and talked to a lot of doctors about her pain management, and it ended up being one of our surgeons were listening to us and said, you know, there's a lot of children complaining that have this metal rod in their back, and she said, we're really looking into this, and she said, we're hearing you. And then the next thing we knew, we had these shots available to us, which have made a world of difference for Laura.
Soothe him by talking to him in a calm voice, telling him to breathe in slow, out slow, and to see the pain in his mind and push it away from him. Push it away like the water runs in and the waves are coming and push him out. And to keep him calm. That Jawan would go to the point where he's the type of child, he doesn't take a lot of pain medicines. Even when he's after every surgery, you're like, Jawan, you want something for pain? It take a long time before he'll say, okay, give me something now. He handles pain pretty well. And after any surgery, if he wasn't up in a half an hour headed to that playroom, limping down there in this little gown, going to the playroom, and he wasn't up, then we knew that he was not feeling well. There's a video game. That's what I told him. Life and all this with your life is a video game, Jawan. You love video games. And that's how he dealt with most of his pain, was video games. So I told him, sometime on a video game, you'll get to a high level, and then whoop, 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 you might fall down and have to start over again. That's what it is, but we'll get there. You're very smart, you're very bright, and you just had time away where you don't understand what they're doing right now.
They have something here called a poke plan, and so they would set up a meeting with you and your son or daughter and kind of go through the steps of how you would like to be, you know, to get needles in your arms or have procedures done or something like that, so that the kids are really comfortable and they have a say. And I thought, you know, that was always really something that I thought was unique at U of M. You know, a lot of other places that the nurses just come in and say, we're going to give you a shot now, and, you know, and sometimes that child really needs to prepare for that somehow, you know, and every child is different, every parent is different, and every situation is different, and they really take that into account here.
Max has always had an unbelievable tolerance for pain. Even for stepping back, we were asked a number of times about signs and symptoms for the tumor, the size of the tumor that he had, showing such little effects on him. And they would ask us if we were bad parents in a way, like, can't you see, or didn't you see anything? But his tolerance for pain was always amazing. And his surgeries, he would go through these 6-7 hour surgeries, spend 24 hours in ICU, and then often discharged the next day. And I always marveled at that, and it always helped me in dealing with that, because I knew if he was handling the situation so well, there's no way I wasn't going to be there for him.
I had some surgery for my congestion.
The funny thing for her is she'll say, no.
It hurts when I have my surgery here.
But she does. She has a VP shunt, and I don't know if that's what causes her pain, but she talks about pain in her eye a lot, or her head. She'll say her head hurts.
If I have a pain somewhere, what I do is like tell either my mom or my dad or somebody.
But it's not normal pain, you know. Most people don't have a stabbing pain in their eye. She's got this knee injury right now that I guess any kid could injure their knee, but hers just doesn't heal the same way. And she's had lots of surgeries. And the pain that she associates with the surgeries is the ripping off of the adhesive tape.
Some of the things that help when I'm like in pain somewhere, sometimes I get hugs, or I get red too, or I sleep.
She had a major surgery all across here, and the tape, she was taped from here down to her thighs, and that had to be changed 3 times a day. And that was a tough time.
It doesn't help me when I have pain, like when I have like a headache or something. It doesn't help when there's a lot of noise going on.
Dealing with the pain that she has associated with surgeries, it depends on what it is. I mean, you know, like, she's so stinking tough. She had her first surgery the day after she was born. I don't think she registers pain the way that most people do, you know? Like the pain that's associated with the incisions and, or the tube being put down her throat, you know, that would give you a sore throat. That never seems to bother her. It's the pain associated with the ripping off of the tape that, you know, it leaves your skin raw and it hurts and it's scary. And so when she has to deal with that, we just make sure that we have that detach all and that we take our time. It just takes a long time to get tape off of Katie.
One thing that could help is you could like distract yourself from whatever's going on.
So those are the kinds of pains, like the topical pains, are the ones that she registers the most. The deep pain, she just deals, she's, you know.
The helpful way to deal with procedures like that is to just stay calm, breathe, and just try to tough it out. I'm going to teach you how to belly breathe. So what you do is you have to relax your shoulders first, and then you put your hands on your tummy, and you have to pretend that you have little teacups on your shoulders, and you have to keep them down. And you have to breathe through your nose and out through your mouth, slowly.